Dr. Levin.
Hi, Dorothea. How are you? All right, how are you?
Good. My name is Dorothea Altschul, and I'm the Director of Neurointerventional Neurosurgery at the Valley Hospital.
My name is Dr. Ken Levin. I'm the Medical Stroke Director at the Valley Hospital. I work there as a neurologist, heading up the Comprehensive Stroke Center with Dr. Altschul. We have some questions from the public regarding stroke that we would be happy to answer today.
The first question is, what is a stroke and what happens when you have a stroke?
A stroke is basically an event that occurs in the brain because of loss of blood flow. And with the blood flow, you lose oxygen and nutrients that are important to help the brain function. So what happens after a blood vessel may become occluded or there's a hemorrhage, not enough blood supply gets to a certain area of the brain, and it can manifest or cause weakness or numbness, difficulty speaking, aphasia, visual loss, headache, or even problems with the balance and gait. Another question is, what is the treatment for stroke? And are there any other special advancements in treating stroke?
There are actually treatments for stroke, particularly for patients who arrive very early to the hospital. Hence, it's very important to call 911. Once you arrive in the hospital, some people will qualify for a treatment that is applied through the vein, a medical treatment called Altschul, and that's a drug that can dissolve blood clots in the brain. This drug is associated with an improvement in 10 to 50% of cases where it is actually able to dissolve smaller kind of clots. For larger clots that have lodged into larger arteries, some patients, if they present within 24 hours of their stroke onset, can qualify for a mechanical retrieval of these blood clots. The way this is done is that the body is accessed through a catheter through either the wrist or the leg, and under continuous x-rays using something called fluoroscopy, a device is advanced to the affected blood vessel, where then the blood clot gets suctioned out, or a wire mesh trap is used to engage the clot and retrieve it from the brain. So is there anything that can be done to reduce the risk of stroke?
Yeah, risk factors are plentiful, actually, and probably in the United States, the number 1, 2, and 3 risk factors would be high blood pressure, hypertension. Very important to have that checked and followed. Diabetes, high cholesterol, diseases of arteriosclerosis of the blood vessels in the neck, such as the carotid arteries, vertebral arteries, or basilar arteries. Smoking, different types of drug use. Heart disease is a big risk factor, particularly cardiac structural heart disease of the valves, or an arrhythmia called atrial fibrillation, which carries with it a very important risk for having stroke if left undetected or untreated.
So, Dr. Levin, what would you advise the community to do if they are seeing someone having a stroke? How can they recognize it, and what should they do?
I always tell my patients the easiest way to treat stroke is to prevent it in the first place by addressing those risk factors. That said, if a patient has identifiable symptoms such as the weakness or difficulty speaking or the numbness or the visual loss or the stumbling gait, they should call 911, or the family or the loved ones or the witnesses should immediately dial 911. That's the fastest and most efficient way to get the patient into the system to be treated at the Comprehensive Stroke Center. Why choose Valley for stroke care?
It is wonderful that there is a hospital like the Valley Hospital in the community, because time is brain. And the faster you present to the hospital, the more likely you will have a good outcome for when you're suffering a stroke. There are many hospitals around, but it is important to realize that not all hospitals have the capability to treat stroke comprehensively, from prevention to rehabilitation, and also really high-end care in terms of treatment, both for the ischemic type of strokes but also for the hemorrhagic types of strokes, where we have different treatment methods, such as treating ruptured aneurysms in the brain, or other hemorrhages in the brain, which is not something that every hospital can do. And we are very fortunate that such a hospital exists in our community.
So I just want to conclude by saying, don't think just because you're young, you're immune to stroke. We're seeing that in the population of people under 50, about 15% of the strokes that present are in young people. So everybody's involved with this, and it's more important to pay attention to the risk factors, treat them ahead of time if you can. However, if you have a stroke or a hemorrhage, I think that Valley is an excellent place to come for your acute care as well as your follow-up care. If you need more information about our stroke center, that can be found on our website.
And we have also a stroke support group for those people who have suffered a stroke. That's also something that not every hospital has, and again, the information is on the website.